Original article. Intravesical instillation of platelet-rich plasma for treatment of interstitial cystitis, bladder pain syndrome. A pilot study. Objective. The aim of this study was to evaluate the feasibility of intravesical instillation of platelet-rich plasma, PRP, to treat interstitial cystitis, bladder pain syndrome, IC, BPS. Materials and methods. 20 PRP samples were tested in vitro for stability after exposure to urine samples with different pH. A pilot study involving 21 female patients with IC, BPS was conducted, and 6 weekly doses of autologous PRP, 50 milliliters, were administered. Patients were followed up at the 2nd, 4th, 8th, and 12th weeks after terminating instillation. The primary endpoint was the Visual Analog Scale, VAS, for pain, and the secondary endpoints included the IC Symptom Index, IC Problem Index of the O'Leary-Son Questionnaire and Global Response Assessment, urine culture, and uroflowmetry. Success was defined as a reduction in VAS by 30% or more compared with basal level, and adverse events were recorded. Results. The mean plus or minus SD of VAS was significantly reduced compared with basal level, 4.4 plus or minus 2.6 versus 8.8 plus or minus 1.1, respectively, p equals 0.001. Meanwhile, 80% of cases were considered successful, with a 50.1% reduction in the mean score compared with the basal level. The mean plus or minus SD of IC Symptom Index and IC Problem Index significantly improved compared with the basal level. Global Response Assessment was markedly, moderately, and slightly improved in 2, 10%, 10, 50%, and 5, 25% patients, respectively, and showed no change in 3, 15%. 3 patients had positive urine cultures at follow-up, but 1 withdrew after 2 sessions because of lack of efficacy. Conclusions. Repeated intravesical instillation of PRP could be considered an effective and safe approach for treating IC, BPS. Additional information and the full text of the article can be found on the journal's website. All links are in the description below the video.